Have you ever wondered if managing diabetes in your later years is simply about sticking to the same old advice? I'm here to tell you that for those in their 60s and 70s, it's a completely different ballgame. The advice you've been following might not be wrong, but it's likely incomplete. Today we're covering 7 essential tips for managing diabetes in your 60s and 70s. These aren't your typical tips about dry skin or slow-healing sores. We are diving deep into a complete guide exploring critical areas that are rarely discussed. In the United States and across the world, managing diabetes as you age requires a more sophisticated approach, and that is precisely what we are going to break down. This video will give you the advanced knowledge you need to thrive. 1-to-1 combat muscle loss. This is more than just age-related muscle loss. Sarcopenia is a progressive skeletal muscle disorder involving the accelerated loss of muscle mass and function. For older adults with diabetes, it is a particularly dangerous adversary. The process can start in your 50s with a 1-to 2% loss of muscle mass per year, accelerating after age 60. This isn't just about becoming weaker, it's about a fundamental shift in your body's metabolic engine. Your muscles are the largest consumer of glucose in your body. When muscle mass declines, your body's ability to pull sugar from the bloodstream for energy is significantly impaired. This directly leads to higher blood glucose levels and increased insulin resistance, making your diabetes much harder to control. The connection is a vicious cycle. Diabetes itself can worsen sarcopenia. High blood sugar and inflammation can inhibit the body's ability to repair and build muscle. This means having diabetes actively contributes to the breakdown of the very tissue you need to manage it. The consequence of ignoring sarcopenia isn't just a number on your glucose meter. It translates to a higher risk of frailty falls and fractures. It can lead to a loss of independence, making it difficult to perform daily activities. This physical decline is often accompanied by a decrease in overall quality of life and can even increase the risk of hospitalization. Addressing sarcopenia requires a two-pronged approach. First is resistance training. This doesn't mean you need to become a bodybuilder. Simple exercises using resistance bands, light weights, or your own body weight are incredibly effective. Activities like chair squats and wall push-ups 2 to 3 times a week can stimulate muscle growth. The second crucial element is protein intake. Older adults often need more protein to stimulate muscle protein synthesis. Spreading your protein intake throughout the day is more effective than consuming it all in one meal. Discussing this with your healthcare provider or a registered dietitian is a vital step. They can help create a safe exercise and diet plan tailored to your specific needs. 2. Address silent hypoglycemia. This is a condition where you no longer experience the typical early warning signs of low blood sugar. The shaking, sweating, and palpitations that once served as your body's alarm system become muted or disappear entirely. This silence is incredibly dangerous because the first sign of a hypoglycemic event could be severe confusion, loss of consciousness, or a seizure. In your 60s and 70s, your body's response to low blood sugar changes. The hormonal counterregulation, your body's natural defense to raise blood glucose, becomes less robust. The release of hormones like glucagon and epinephrine is often delayed and diminished. Years of having diabetes and recurrent episodes of minor hypoglycemia can retrain your brain to tolerate lower glucose levels before sounding the alarm, creating a state known as hypoglycemia-associated autonomic failure. The immediate risk is a severe hypoglycemic event, which can lead to falls, accidents, and injuries. A fall for an older adult can be a life-altering event, but the consequences extend further. Research shows that severe hypoglycemic episodes in older adults with type 2 diabetes are associated with an increased risk for dementia. Each episode can have a cumulative impact on cognitive function. The fear of these silent lows can also lead to defensive eating or intentionally keeping blood sugar levels higher, which ultimately leads to poor long-term glucose control. Does this feel familiar? You've eaten healthy all day, but your evening blood sugar is still high. Let's break down why. Managing this requires a multifaceted strategy. First, frequent blood glucose monitoring is non-negotiable. This is where a continuous glucose monitor, or CGM, can be a game-changing tool. A CGM provides real-time glucose readings and can alarm you if your levels are dropping even before you feel symptoms. It provides a safety net that is especially valuable overnight. You should also work with your doctor to review your medications. Certain drugs, like sulfonylureas, carry a higher risk of hypoglycemia. Your provider might consider switching to newer medications with a lower risk profile. Educating your family and friends about the signs of severe hypoglycemia and how to administer glucagon is also a critical safety measure. Always carry a source of fast-acting carbohydrate with you. 3. Simplify your medication plan. Polypharmacy is the simultaneous use of 5 or more different medications. In your 60s and 70s, especially when managing diabetes alongside other age-related conditions, it's very easy to find yourself in this situation. About 40% of elderly individuals with diabetes have 4 or more comorbid chronic conditions, each potentially requiring its own medication. The problem isn't just the number of pills, it's the intricate web of potential interactions. Each new medication increases the risk of an adverse drug event. One drug can alter the effectiveness of another or combine to create a toxic effect. For example, a new arthritis medication might impact kidney function, which in turn affects how your diabetes medication is cleared from your body. The biological reason this is so challenging is due to age-related changes in pharmacokinetics, which is how the body processes drugs. As we age, kidney and liver function often decline, meaning drugs can stay in the system longer and at higher concentrations. A standard dose that was safe for you at 50 could be problematic at 70. The consequence of unmanaged polypharmacy is a heightened risk of medication-related harm, like dizziness and confusion increasing fall risk. It can also lead to non-adherence. A complex medication schedule is harder to follow correctly, leading to missed doses and uncontrolled chronic conditions. It can be a significant source of stress and may lead to unnecessary hospitalizations. I know there's a lot of debate online about metformin. We're going to cut through the noise and look at the clinical studies. The solution is proactive and regular medication reviews with your healthcare provider and pharmacist. This should be a dedicated appointment to go over every single medication you take, including over-the-counter drugs and supplements. Ask questions like, is this medication still necessary? Is this the lowest effective dose? Could we simplify the regimen? This process is sometimes called deprescribing, the planned and supervised process of dose reduction or stopping of medication. Don't be afraid to advocate for yourself and push for a simplified and safer medication plan. 4. Protect your cognitive health. Cognitive decline refers to a noticeable decline in mental abilities such as memory and thinking skills. It's a spectrum that ranges from subtle issues to more severe conditions like dementia. While some cognitive change can be a normal part of aging, diabetes significantly increases the risk and accelerates this decline. People with diabetes have a higher incidence of dementia compared to those without the condition. The link is multifaceted. Chronic high blood sugar or hyperglycemia is toxic to the brain. It can damage small blood vessels, impairing blood flow and promoting inflammation. On the other end of the spectrum, hypoglycemia or low blood sugar is also detrimental. The brain is highly dependent on a steady supply of glucose. Episodes of severe hypoglycemia can cause immediate brain cell damage, and research shows a direct link to an increased risk of dementia in older adults. So what? Here is profound. Cognitive impairment makes the complex task of managing diabetes exponentially more difficult. It can hinder your ability to perform essential self-care like monitoring glucose, calculating insulin doses, and adhering to a medication schedule. It can create a dangerous feedback loop where poor diabetes management worsens cognitive function, and declining cognitive function leads to worse diabetes management. This can ultimately threaten your ability to live independently. Of course, everyone's journey with carb counting is different. I'd be very interested to hear what's worked for you. Share your single best tip in the comments below. It could really help someone else reading this. Addressing this requires early detection and proactive management. If you or your family notice changes in your memory, it's crucial to discuss this with your doctor. From a diabetes management perspective, simplification is key. This might involve switching to a simpler insulin regimen. Using a continuous glucose monitor with alarms can provide a crucial safety net. Pill organizers and reminders can help with medication adherence. Involving a care partner or family member provides another layer of support. Maintaining good blood sugar control, avoiding both high and low extremes, is one of the most important things you can do to protect your brain health. 5. Prevent falls and other syndromes. Geriatric syndromes are a collection of common health conditions in older adults that don't fit into discrete disease categories. These include frailty, chronic pain, urinary incontinence, and an increased risk of falls. In your 60s and 70s, these syndromes become more prevalent, and diabetes significantly increases your risk for nearly all of them. These conditions are often interconnected. For example, nerve damage from diabetes or neuropathy can cause numbness in the feet, leading to an unsteady gait, which increases fall risk. The fear of falling can lead to decreased physical activity, which in turn worsens muscle mass and leads to higher blood sugar levels. This shows how these syndromes are deeply intertwined with diabetes. The underlying science connects to the long-term effects of high blood sugar. Chronic hyperglycemia damages nerves and blood vessels. Damage to nerves controlling the bladder can lead to urinary incontinence. Damage to nerves in the feet causes peripheral neuropathy. Diabetes also accelerates the loss of bone and muscle density, contributing to frailty. Vision problems like diabetic retinopathy can also severely impact balance. Ignoring these syndromes can have a devastating impact on your quality of life. A fall can lead to a hip fracture, a major event from which many older adults never fully recover. Chronic pain can lead to depression, and incontinence can be a source of embarrassment. These are not just minor inconveniences, they are significant health issues exacerbated by diabetes. Managing them requires an integrated approach. Your healthcare team should be screening for these syndromes regularly. Physical therapy can be incredibly effective for improving balance, strength, and gait. Pain management might require specific medications that don't interfere with your diabetes control. It's crucial to have an open conversation with your provider about these issues. They are treatable conditions, and managing them effectively is a key part of your diabetes care plan. In just a few moments, I'm going to reveal the single most important mindset shift for thriving with diabetes in your 60s and 70s. But first, let's cover another critical topic. 6. Reevaluate your A1C goals. De-intensification is a planned approach to reducing the complexity of your diabetes treatment. It often means lowering medication doses or even stopping a medication that no longer provides a clear benefit or may be causing harm. This concept is crucial for individuals in their 60s and 70s, where the risks of overly aggressive treatment can outweigh the benefits. The traditional goal of diabetes management has often been to drive the A1C as low as possible. However, major clinical trials have shown that for many older adults, pushing for very tight glycemic control can actually increase the risk of severe hypoglycemia and even mortality without a significant cardiovascular benefit. As we age, our bodies change. Kidney and liver function may decline, and other health conditions increase. These factors change the risk-benefit equation for many diabetes medications. An aggressive treatment plan that was appropriate at age 55 may become dangerous at age 75. The primary risk of overtreatment is severe hypoglycemia, which is particularly dangerous in older adults. A complex regimen is also a significant burden, leading to stress and a lower quality of life. It can be difficult to manage, leading to errors in dosing, and polypharmacy increases the risk of side effects. It's a classic case where more is not always better. The solution is to work with your healthcare provider to individualize your glycemic goals. The American Diabetes Association recommends that for many older adults, a reasonable A1C target might be less than 7.5% or even 8.0%, especially for those with multiple chronic illnesses or a history of severe hypoglycemia. The focus shifts from hitting a specific number to a holistic approach that prioritizes safety and quality of life. This may involve deprescribing certain medications and simplifying regimens. This doesn't mean giving up on diabetes control. It means finding the right level of control for you at this stage of your life. It's about smart, personalized care that recognizes your unique needs. 7. Support your emotional well-being. Living with a chronic condition like diabetes is not just a physical challenge, it takes a significant mental and emotional toll. Two of the most common issues are diabetes distress and depression. Diabetes distress is different from clinical depression. It refers to the frustration, anger, and feeling of being overwhelmed by the relentless demands of managing diabetes. It's the emotional burden of constant monitoring, carb counting, and the fear of complications. It is a natural response to the reality of living with a demanding chronic illness affecting up to 50% of people with diabetes. The constant vigilance required can lead to burnout and fatigue. If left unaddressed, diabetes distress can lead to poor self-care. When you feel overwhelmed, you are less likely to adhere to your treatment plan, which leads to poor glycemic control and creates a vicious cycle. Clinical depression is also twice as common in people with diabetes. Its symptoms like low energy can make diabetes management even more difficult. The consequence of ignoring the mental side of diabetes is a significant reduction in your overall quality of life. It can strain relationships and lead to social isolation. It is just as important to manage this aspect of your health as it is to manage your A1C. The solution is to acknowledge these feelings and seek support. You are not alone. Talking to your healthcare provider is a crucial first step. They can screen you for both diabetes distress and depression. Peer support groups can be incredibly valuable. Connecting with others who truly understand the daily challenges can reduce feelings of isolation. Seeking help from a mental health professional who has experience with chronic illness can also be very beneficial. Cognitive behavioral therapy is very effective for both conditions. Remember, managing your mental and emotional well-being is not a sign of weakness. It's a critical component of a successful diabetes management plan. If you enjoyed this video, you will probably also like this one. Please subscribe to this channel and let us know in the comments your thoughts. Thanks for watching.